Welcome, everyone. I'm Jeff Whittle. I'm the Dean of the Ontario Veterinary College, if you don't know me, and I am very pleased to be able to introduce to you, if you don't know her already, Dominique Charron. Dr. Charron is well known, I think, to a lot of people at the college, having done her graduate programming here some years ago. We were just reminiscing on those days, those heady days of the early time of the Department of Population Medicine that had been established only quite recently, and the amazing group of grad students that went through those early days and have gone on to really interesting and impactful careers. And Dr. Charron's career is just such one of those impactful careers. And we're so pleased to be able to welcome her today to talk to us a little bit about One Health and where she thinks it is going globally. I'm going to read a little bit of a bio for Dr. Charron because it's quite extensive and I do have to read it. I haven't committed it to memory. She is currently a visiting scholar in One Health here at the University of Guelph. In her previous role, she was Vice President of Programs and Partnerships at Canada's International Development Research Corporation, as we know it, IDRC, where she led research for development programming strategy and built partnerships towards supporting knowledge and innovation in developing regions led by researchers in those regions. She contributed to writing IDRC's new Strategy 2030, and a transformational agenda for the organization. She has implemented a new framework for more gender responsive and inclusive programming that reduces inequalities in the world. She was instrumental in building IDRC's global health, animal health, innovation, and emerging infectious disease prevention and control programs. And she co-authored the Center's Pandemic Preparedness Plan in 2009. Dominique previously was IDRC's Director, Agriculture and Environment and Program Lead, Ecosystems and Health and Human Health. As I mentioned, Dominique got her PhD here and her DVM from the University of Guelph. Welcome back. And previously, she managed research programs in infectious disease, environment, and climate change, and engaged in international cooperation with Caribbean developing countries, while at the Public Health Agency of Canada. She has authored reports, editorials, an edited volume and articles in peer review in the areas of One Health, EcoHealth, and emerging diseases. And she lives currently in Ottawa. And welcome, Dominique, and thank you for doing this for us. And we look forward to your seminar.
My goal today is more to pose this question than to answer it, and maybe give you a couple of hints of what's been happening at the international level, but also to bring it home, closer to home, with a little bit of a coverage of what Canada has been doing to implement a One Health approach. And I'm really pleased to be here on the treaty lands and territory of the Mississaugas of the Credit, and really acknowledge their stewardship of the land and the waters of this place, and to acknowledge also that the university is home to and hosts Indigenous people from many nations and peoples in Canada as well as around the world, and acknowledge their contributions to knowledge here. I live on the unceded traditional territory of the Algonquin people in Ottawa, but it's always part of my journey on this road to reconciliation to learn more about the peoples of places I visit. So no surprise, likely, if you're in this seminar, to think about why it is that we might need a different approach to health and consider the intersection of issues that arise at the intersection of health, human health, animal health, and ecosystems and their continuity and sustainability. A number of changes and drivers that are all human driven, anthropogenic in nature, are bringing about changes in how ecosystems function. They're presenting new challenges for animal health and new threats for human health. All of that together is requiring us to think differently about how we tackle these problems in order to improve overall the outlook of human, animal, and ecosystem health and sustainability, and really aligns with our university's strategy of improving life and aligning with the Sustainable Development Goals of the UN. Now, for those of you who are not familiar with the Sustainable Development Goals of the UN, There are 17 of them. They are meant to be taken as a whole and tackled together. It's extremely ambitious. The pandemic of COVID set us back by about 5 years or more on that agenda and erased some of the gains that have been made. And as a result, there is no way that we're going to achieve the Sustainable Development Goals, like eliminating extreme hunger and infectious diseases and eliminating childhood mortality by 2030, which is in 7 years. The focus of my talk today is going to be on what's happening and happened around One Health during and since the pandemic, the COVID pandemic. But the COVID pandemic, although we were surprised globally by this, was not a surprise, and those working in this field had seen it coming. Why does it matter, and why do infectious disease epidemics get so much attention? They're extremely disruptive and extremely costly in a short period of time. There are other humongous problems: climate change, its impact on animal well-being, ecosystems, the extinction crisis. These are all extremely costly problems, but that are spread out over more time. And that's why we tend to see this great attention on epidemics. This is an old slide from 2009 that tried to show the increasing not only frequency of animal epidemics, which are called epizootics, and epidemics of human disease, and how the costs of those were mounting. And the big yellow circle was the SARS outbreak of 2003, which was at the time at 30 to 50 billion US dollars of 2003 dollars, the most expensive epidemic. But of course, here it is again, SARS. Now we have had many more significant infectious diseases, zoonotic diseases, pandemic threats to human health that have gained increasing attention. And you can see there that there is a trend towards increasing frequency of that. So understanding what's driving this and putting in place new, better ways of being prepared, yes, but hopefully moving the needle towards preventing them and changing how we interact with our environment and with each other to try, and with the animals that we depend on, to try and move the needle to reduce these kinds of threats. We certainly don't want to go through what we've just been through again. Now, I'm going to come to a definition of One Health in a minute, because for some of you this may be a newish concept. But I'll just speak a bit more about where the global landscape is in the conversation that involves the intersection between human, animal health, and environmental sustainability. If we go back to 2005, 2006, the outbreak of avian influenza, highly pathogenic avian influenza, you may or may not remember, but it was killing people. It was killing people in Asia. It seemed to be at risk of becoming more transmissible to people, if not between people. And there was great fear at that time that this was going to be the big one. Now, that was wrong, right? We've just been through the big one. It was a coronavirus, not a flu virus. However, it's still present, the same H5N1, and quite prevalent globally, has spread a lot in bird populations around the world, and is infecting newly, in the recent couple of years, infecting mammals. So there is renewed concern that this avian influenza will be the problem. But back then, this brought the international agencies, the Food and Agriculture Organization, then it was called the Office International des Epizooties, which is the World Organization for Animal Health now, and WHO, the World Health Organization, to work together to try and tackle the threat from avian flu. This led many years later to a formalized agreement between these international organizations to contribute to a world that would actually be capable of preventing, detecting, containing, eliminating, and responding to these public health and animal health risks that are attributable to diseases that are transmissible between people and animals, as well as animal diseases that have a big impact on on food security, like foot and mouth disease. Now, we could see, so the intention was there. There's quite a bit of good work that went in there, and that the world was actually, because of that work on avian influenza, a little bit better able to respond to COVID than it would have been otherwise. At the same time, over the past decade or so, there's been increasing attention to antimicrobial resistance, or AMR, which is what we might consider to be a slow pandemic threat. Because if we are faced with a superbug against which we have no antibiotics, then old problems that used to kill people that don't, like pneumonia, as much as they used to, or even skin infections, a cut, post-surgical infections will again start to kill people. So it is a major threat, and has also mobilized quite a bit of attention and collaboration between public health authorities and animal health authorities. For those of you who don't know, antimicrobials are used 10 to 1 more in livestock production, both to treat illness, which is fair enough, but also to promote growth and prevent disease, which leads to a very large use of antimicrobials. Not always the same ones that are used in human medicine, but then this is contributing to a heavy burden of resistance to those antimicrobials. The One Health high-level expert panel that I am a member of and the rapporteur for was created in the first months of the pandemic, when Germany and France requested the UN to please do something about getting more advice together to help inform countries and international agencies on how to prevent another COVID-type pandemic. And so here you see just a little bit of a timeline. A very important step in this was that in 2021, the United Nations Environment Program joined that pre-existing collaboration of the 3 other agencies to really bring in a stronger environmental sustainability angle. In 2022, so just last year, the World Bank created the Financial Intermediary Fund, which I never remember what it is, which is why it's on the slide, for pandemic preparedness, prevention, and response. And this is a significant fund that particularly countries, lower income countries, are eligible to apply to for funding to put in place prevention and preparedness programs in their countries. Now, while an integrated approach to public health, animal health, and environment is part of that, it's not a requirement necessarily, but at least there is a channel here for countries to access resources to put in place what they need differently. And just recently, at the last World Health Assembly, which is what OHI stands for, the ministers of health, who are the governors of the World Health Assembly, of all the member countries of WHO, included in a new resolution on chemicals, waste, and pollution, so moving beyond infectious diseases, where they said countries should put in place a One Health approach when they're thinking about chemicals, waste, and pollution, and not only look at it from a human health perspective. The other major piece of global policy that's moving forward, that's an opportunity for us to influence how people think about pandemic prevention, is the development of a global pandemic treaty. At the moment, it's still called instrument, but essentially it is all countries coming together to decide what's needed in order to be able to work better together in the event of a future pandemic, such as what we've just been through. That's going to be ratified in 2024. So there's an opportunity there to strengthen the integration of an interdisciplinary approach in how countries approach preparedness for the next pandemic. Although this is a One Health panel providing advice to these same agencies, I can tell you it's just a small clause for the moment, and not substantially in there. So as part of this One Health high-level expert panel, myself and the 26 co-panelists from all around the world provide advice to those 4 agencies to help them put forward a One Health plan and implement that One Health plan, and support the countries, the member countries of the international agencies, to support the One Health implementation. Our mission started off pretty narrowly focused on zoonotic diseases, the typical kind of infectious threats that you would expect a One Health approach to be used against or for. One of our first jobs was to look at all the different definitions of One Health and come together with our advice to the agencies on what we thought would be a unifying kind of definition. And this was published in PLAW's Pathogens in 2021. And if you're interested, I can share that with you. And we've put forward essentially an integrated, unifying approach, One Health, that aims to sustainably balance and optimize the health of people, animals, and ecosystem, and that recognizes that the health of people, animals, and ecosystems are closely interdependent, not just interconnected, but interdependent. We need each to be healthy in order to have health of anyone. It also recognizes that it's not just an idea, but in order for One Health to be implementable, it requires action by society, action by sectors and discipline, and it requires different ways of working. And we call these the 4 C's, but collaboration, capacity building for working differently, coordination across sectors for a common goal, and communication about what it is to work differently across sectors, what the common goals may be, and what actions need to be taken. And this little cogwheel thing apparently is the thing that most differentiates this new definition from past definitions, which focus on the interconnections. What do we do with those interconnections? The other really important part of this definition is that it is supported by or underpinned by some important principles. The principle of equity, that people and sectors and disciplines need to have equitable kind of voice in advancing One Health, that inclusion is part of One Health action, and that communities and marginalized voices need to be considered in a One Health approach. The idea of sociological equilibrium, and I always open a parenthesis here because I've trained under some ecologists on this campus who say there is no such thing as equilibrium when you're talking about an ecological system, and it may not be desirable even if it did exist. However, bear with us that the concept of seeking a balance between human needs and actions in the environment, as well as the needs of animals, and what's needed for those ecosystems to be perpetuated in the ways that we want them to be perpetuated is part of this. The other criticism that has been leveled at One Health as a concept is that it's very anthropocentric, that this is about people's well-being and less about animals and less about ecosystems. And, you know, in fairness, that happens. And it's part of our work as the advisory body to the international agencies to keep reminding them that it's more than that. But there's also this anthropocentric aspect to this, that people need to change and people need to take actions, and there's a stewardship and responsibility angle to One Health that arises that only people can do. We can't ask animals or ecosystems to do this. And of course, transdisciplinarity, which if you are a scholar of transdisciplinarity, not only interdisciplinary, but also bringing in different forms of knowledge, traditional knowledge, communities, and action. We worked extensively from this definition to help think of a theory of change. So how do we go from where we are now to a more desirable future, a world that's better able, in remembering that this is our narrow mandate, to focus on pandemic prevention, to predict, detect, and respond, and to do that while contributing to a more sustainable world. Clearly, there's short-term goals where we need to support the agencies in implementing the joint plan of actions. That's what JPA stands for, and I'll talk about it a bit more. We have the Sustainable Development Goals, the SDGs for 2030. There's a lot of contributions that One Health and its integrating way can contribute to achieving or helping reframe the achievement of SDGs. And then longer term, we're talking about a better world. We're talking about a more sustainable, healthy world. And this is where the implementation in all countries of more One Health should take us. Now, one of the key pieces of work that we accomplished over the past 2 years was to help the 4 international organizations. And the reason I'm not saying UN is that the World Organization for Animal Health is not a UN body. It predates the UN, and it is a separate international intergovernmental organization. So the 4 partners of the quadripartite, the international partners, have come up with a joint plan of action. Now, this sounds, a little bit bureaucratic, and you should read it. It's quite a tour de force that they've pulled this off, and they pulled it off in about 8 months. I've never seen international organizations work so quickly and so effectively together. And not only that, but it's not just a high-level aspirational document. There's a lot of aspiration there, but they wrote it with a view to really implementing it. There are 6 action tracks, maybe easier for you to see that than for me, and I should know them, but 6 action tracks of the implementation plan and the associated implementation guide, including enhancing the capacities to implement, helping assess the risks from emerging and re-emerging infectious diseases, eliminating neglected zoonotic and vector-borne diseases, and tackling antimicrobial resistance, which is action track 5, strengthening the assessment, management, and communication of food safety risks, and taking an integrated animal health, environmental sustainability and health, and human health lens to that. And across all, really, bringing a stronger environmental lens to this: climate, biodiversity, and understanding the necessity of healthy, sustainable ecosystems in order to continue to enjoy the services they provide. Action tracks for implementation. You see here in the middle of the graph, a big angle on governance, policies, legislation, finance, and advocacy. Then strengthening capacities to actually do this, both technical and softer skills. Collaboration, intersectoral, and transdisciplinary approaches are not innate or natural in most agencies that are involved in implementing this work. And then data, improving the quality of data, sharing of data, the interoperability of data, the semantics in order to understand how data change. I learned this morning in conversation with Teresa and Deb and team, knowledge and evidence. So here's where research comes in to help inform the implementation. How's it going? Well, they're just starting, but I have to say, QPT stands for quadripartite, and they've started and are conducting over the next several months regional stakeholder workshops. I believe there was one in Ottawa in May for Canada, and there are more scheduled in all the regions of all the regions of the world to get feedback on how this is going to work. You see in this slide the priority recommendations that the quadripartite agencies have heard from the stakeholders in the field. They would like this, although global plans are great, implementation culture, institutional cultures, and ways of doing are very different in different regions of the world: Middle East, Latin America, Canada, Europe. Please consider a little bit more regional flavor to this. Resources, technical know-how, expertise, and funding to help countries adapt and implement. Collaboration with universities and technical institutions to support more knowledge on how to do this. So One Health expertise, One Health training programs at all levels, from the top in terms of executive leadership right down to graduate students and potentially even children. And conduct create spaces for people to come together and talk about how it's going and learn together about how to implement better. There are lots of barriers, and I'll talk about them a little bit more. You see some on this slide. There's a lot going on. People are very busy, and finding ways to work One Health implementation into what people are already doing with not enough resources is hugely challenging. For the international organizations, this is their thinking in terms of rollout and implementation. They are finalizing the implementation guide, all the templates and annexes. This is very, very typical intergovernmental organization, but really they are trying to think of what countries will specifically need to implement this. More information sessions, more regional consultations. The guide should be out in August or September, and it would be launched before the end of the year. I'm glad it's not my responsibility to get all that done by then, but there are resources being allocated to this by the international organizations, so we see that moving. Now, this is a very busy slide, and I don't expect you necessarily to absorb all that's on there, but one of the pieces of work that we did with the panel was to realize that there were a lot of tools, guides, and templates and helpful things out there to help countries implement this, and it was becoming difficult to find the way through or to understand when to use what tool and in what order. There was a paper published back in 2018. One of the authors is a member of the panel, Casey Barton-Baravesh. She is the head of the emerging zoonotic response team at the US CDC. And she proposed that we revisit this paper that had been done then with all the existing tools and the new tools that have been developed, and provide an analysis and kind of overview of how these tools can be used, which ones are good, which ones are really One Health, which ones have been used in countries, which countries have they been used in, which ones are more theoretical and haven't yet been tried, and then to sort them out in kind of a workflow that covers sort of the assessment stage, the implementation stage, the planning stage, and planning, implementation, and then monitoring and evaluation. So this is also forthcoming, should be out probably early 2024, but goes to show you the kind of amount of work that's involved, given how much research and contributions have already been made in the field, to try and bring this together in a holistic way so that people can access the information and apply it. So in addition to this tools, which you see at the bottom left, there is ongoing work to define what an optimal surveillance system for emerging infectious diseases would look like, the so-called disease X. How do you detect COVID before it infects the whole world? And what do you do about it if you detect it? Is it possible? There's a lot of arguments about that, but at least if you had the right kind of intelligence coming in, would you be able to spot it and react more efficiently than we did this time? And in order to do that, one needs to understand better what's driving, in what kinds of things are driving the emergence of coronaviruses. There are a lot of them. And not all of them have turned into infectious diseases that are dangerous for people, but many of them have. Could we better understand what's driving that? What's the relationship with people's interaction with the environment? How is bat ecology changing such that these viruses are being shed into environments where other animals are picking them up and then being transmitted to people? There aren't just coronaviruses out there. We're grappling with an avian influenza epizootic now that is also spreading to mammals. How would you better understand what's driving that, and how could you intervene perhaps to reduce the risk of it turning into a significant either animal health or public health problem? So that's what's been happening at the intergovernmental global level. Research, policy frameworks, implementation guides, investment tools, and global treaties that will require commitments, that will require accountability. So everything is in place internationally, I would say globally, for One Health implementation to move forward in a way that it hasn't in the past. But I'll come to challenges in a minute. Soon, actually, because otherwise we'll be at this all day. In Canada, we actually have a number of really good examples of decent, if incomplete, One Health action that go back to when Carol and I were working at the Public Health Agency. So 17 years ago, 20 years ago, these are long-standing programs. One that is looking at how you can identify antimicrobial resistance from farm to fork. So right from the farm, retail, and also what's happening in people. There's also a similar program that looks at foodborne pathogens like E. coli and Salmonella, what's happening on the farm, what's happening in retail, what's happening in people. There's also a couple of really interesting networks that were put in place long before COVID. The Canadian Network for Public Health Intelligence, that's also networked with other public health intelligence networks globally, well, at least in Europe and North America, and the Canadian Community for Emerging and Zoonotic Diseases, which is not just federal, but brings in provinces, academics, and is really a broad, almost wasn't called citizen science then, but has a strong multi-level dimension. So there are, I would call these institutions and models upon which Canada can build. The problem, I would say, with those is that at the top level, there wasn't a recognition that these were anything more than a really good program for preventing foodborne disease, or a really good idea for people to feed into what might be happening with animal diseases and wildlife diseases. But over the past 8 years, Canada has put together an antimicrobial resistance action plan, partly spurred by a parallel pre-COVID process globally that said, world, do something about antimicrobial resistance, from those same agencies. And this pan-Canadian action plan, I have to say, they did it in spades. It's got the federal and provincial and territorial aspect. It's a little bit weak on the Indigenous aspect, but that's coming. And has an implementation plan that is to support all levels of Canadian institutions to take action to reduce the risks of antimicrobial resistance. It has a governance structure, and that governance structure is at the highest level federally and is co-led by Agriculture and Agri-Food Canada and the Public Health Agency of Canada. It's called the One Health Antimicrobial Resistance Steering Committee, or the other way around, but it really has been focused on antimicrobial resistance. There is an opportunity there to strengthen that governance system, because that's where resources come from. It's also how decisions get made, to respond to, for example, avian influenza and to build on more lessons from the pandemic. It includes about 18 different federal departments and is supposed to have similar levels of engagement with the different departments and provinces. It exists. It's better than not existing. What are the challenges? When we think about health in Canada, there really is still a dominance of the biomedical and health security paradigms, despite the fact that the Chief Public Health Officer, Theresa Tam, is a strong advocate for integrated One Health approaches, has done a whole public health report, her annual report on it in the past, and advocates for a more intersectoral approach to the public, to protecting public health. Although that's what decision makers tend to react to most, our public health leaders realize and understand that the health of people is determined by how we keep our animals, the health of animals, what's happening with wildlife, and what's happening with ecosystems. There is, at the global level, a proliferation, particularly during and since COVID, of committees, expert groups, advice panels on pandemic preparedness, One Health, and every sort of dimension that you can imagine. This leads to a lot of noise and not necessarily a clear signal for decision makers who are trying to move ahead. We are also dealing with, when we talk about trying to move the needle to talk about prevention of the kinds of threats that we've been dealing with, whether it's pandemic or food system issues or antimicrobial resistance, it's much easier for countries to react to something that's already there than to invest in and take action on prevention. And then, of course, you're all very aware that we can't just say, this is what the expert panel says and expect the wider population or politicians for that matter to take it as is. There is a sea of misinformation, harmful beliefs, polarization and politicization of science or anti-science that we cannot ignore and that we have to integrate into whatever actions we will take as science advisors. So quickly, just wrapping up, despite those challenges, there really is a need to shift the conversation away from getting ready to respond to the next pandemic with the best possible biomedical response, vaccines, better vaccine manufacturing capacity. Yes, absolutely, it's important, but it will still be like trying to put fingers in a leaky dam. And really what we need to do is to move upstream and address the source of these problems. So as we recover from pandemic of COVID, let us think about prevention more and focus our actions as much, if not more, on prevention than response. Capitalize on the joint plan of action of the international agencies. This is a moment when there's a high level signal that says, countries, this is how it can be done and why it should be done. With that will be opportunities for investment, and we can advocate for more investment by our research councils and the Canadian government in funding this. Likewise, the pandemic instrument and treaty negotiations create a buzz and a demand for this type of knowledge and workforce. There's a kind of separate ecosystem for antimicrobial resistance from the rest of One Health. This has to come together. Even in our high-level panel mandate, they said, you're not allowed to talk about AMR. Somebody else is doing that. Okay. The next mandate of the committee will be different and include AMR. There's a lot of good things happening in Canada and in other places in the world. What's missing, though, is the governance frameworks. And by that, I mean that high-level policy framework and commitment to work together across different departments, across different silos towards these common goals. Without that high-level governance, when Deputy Minister of agriculture, who's a real champion for this, changes portfolio, the ability of the department to continue that work really diminishes. So we need to formalize this more. And that's why I say that Canada is moving to this kind of high level, sounds bureaucratic, but it's actually important for the sustainability and institutionalization of new ways of working. International collaboration. These problems are vast, complex, and it's new for everyone to try and work differently across silos and across disciplines, across sectors to tackle these complex challenges. We can learn from each other. And so that partnering internationally is important. And all of you here, I hope, are thinking about taking this more integrated lens to whatever work you're doing. And you too can be part of the future One Health workforce and helping create that capacity in Canada and internationally to respond differently to these challenges. Thank you very much.